Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.
Discussing the issues and celebrating the successes of the African American community. This is Another View.
Hello everyone, I'm Barbara Ham-Lee. Welcome to Another View. I want to share with you some statistics that you'll probably find startling. According to the Virginia Department of Health, in the Commonwealth of Virginia, African Americans make up 61% of all people living with HIV. Now let that sink in for a moment. Now here's another stat. Black women account for 77% of all women in Virginia living with HIV. Black men are 6 times more likely to be diagnosed with HIV than white men, while black women are 21 times more likely to be diagnosed with the disease than white women. So what's going on with HIV/AIDS in the black community in general, and particularly with African American women? We've gathered some experts to share their insight. Please welcome Alycia Dickens, family nurse practitioner and HIV specialist with EVMS, Ruby Jones, who is living with HIV, and Dr. Zina McGee, Sociology Professor with Hampton University. Welcome to Another View, ladies. Thank you so much for joining me today. I want to make sure that everyone's on the same page first, Alycia, so I'm going to start with you to explain the difference between HIV and AIDS.
HIV stands for human immunodeficiency virus, and basically it's a virus that weakens the immune system. AIDS, on the other hand, acquired immune deficiency syndrome, is HIV progresses to AIDS. So I explain it to patients. I say, HIV weakens your immune system. AIDS, you've basically lost your immune function.
And so that means your body can't fight off
basic
other
type of infections
and so forth. And that's where the problem comes in, because you can't protect yourself against other diseases and so forth. Now, Ruby, you're living with HIV.
Yes, ma'am.
And you and I had a really good discussion earlier before the show, and you said you were willing to share your story with us.
Yes. In March of 2004, I had a stroke, and I had viral spinal meningitis. I was having petit mal seizures, and it got so bad that I passed out in the child support office. And I got transferred from the child support office to the hospital. And at the hospital, I don't really remember a lot. I can remember kind of waking up in and out of going through what I was going through. And I remember my family sitting on the side, and the doctor asking me, did I know where I was? Do you remember what happened? And I said, the last thing I remember was being in the child support office. And the doctor said, well, honey, you had a seizure, and they called an ambulance, and you're here at the hospital, and we're trying to figure out what's going on with you, so we're going to run some tests. And at that time, they ran tests, and I had all these IVs and things hooked up to me. And they ran a CAT scan on my brain, and they found out that I had viral spinal meningitis. They called an infectious disease doc to see how I had acquired it, or why it was so virulent. And what they said is that I had AIDS at that time. So I had been living with HIV and not really knew, because
prior to you were getting sick with the seizure or the stroke, you didn't have any other symptoms. You had no idea.
No. Well, during seroconversion, when you're HIV positive, when your body changes from being having a normal immune system to HIV, it feels like you have flu symptoms. But you don't pay those any attention. You have the flu or a cold, you move through it, and you're essentially fine. You don't think, oh, this could be something more serious. So I never paid any attention. And even as I was getting sicker and sicker and having the little seizures, I had gone to see a neurologist who was treating my seizures, but he never went so far as to think it was an opportunistic infection.
So can you describe to us your emotions when you found out?
Well, I had so many things going on at the time. I was
So really focusing on
Right.
the fact that you had HIV and so forth was not at the top of the
Right.
list.
Well, I had the stroke, so
Okay,
I was
so that was-
more focused on, am I ever going to be able to walk again? How am I going to get through this?
So when you got to that point, though, when you got through those other issues and you were able to focus on the root cause, then what was...
I
what
was
that like?
devastated. The first thing I thought is, oh no, I have 2 children, 2 teenagers. My son was a preteen. I have 2 children. How am I going to take care of them? How am I going to provide for them? I'm not working anymore. I'm sick. I can't do anything for myself. How are they going to survive? I was devastated.
Is that what you normally find, Alycia, when you deal with patients?
Yes, very much so. A lot of women, unfortunately, when I see them, when they come into the clinic, the initial reaction is that of blame. But I think through their journey, what I try to help them with is that at the end of the day, they have to accept some responsibility.
So they want to blame the partner
person.
first,
Exactly.
the other,
Exactly.
before they take on their own responsibility.
Right.
So, Zina, from a sociological perspective, what's going on with black women? That these numbers, when you look at what's happening with other populations, and you look at black women, it's just amazing.
Barbara, there are several factors that really contribute to this. First and foremost, it's still poverty. 1 out of 4 black women remain in poverty. And when you have issues of poverty, you're dealing then with a lack of resources, education, income, employment. That's the first thing. The second factor is the incarceration rate that we tend to see among young black men. What is happening here is that once they are released, they will then infect their partners, and the cycle will continue. That's one of the issues as well. A third is infection itself, improper use of certain things in terms of contraception, in terms of prevention. These are still important factors. And a fourth one tends to focus heavily on this issue of stigmatization. That is it too. We heard this already in terms of blame. We still live in a society where we're going to stigmatize a person who suffers from this illness, and they are already dealing with the sickness themselves, and then they have to face society's label that has been placed on them as a deviant.
Right.
So it's a vicious cycle, and it will repeat.
I hear you shaking your head over there.
Yeah.
What has that been like for you?
Well, like Alycia said, I have just gotten to the point where I'm not angry about being infected, because you have to look at what you did to contract the virus. And what I did is I didn't have protected sex. And it comes down to when you have a partner and you're in a relationship, condom negotiation is not the easiest thing in the world. And most women get into the conversation, well, if you loved me, if you weren't cheating on me, you wouldn't ask me to use a condom if you trusted me.
That's
so
what
now,
the man is saying.
right,
to
that's
the
what the
woman.
man is saying. So now you got to prove that, oh, it's cool, you're okay, we're good. So we're going to have unprotected sex. You open your body up to a million different things when that happens. You have to love yourself enough to say, if you want me, you have to use a condom. And I didn't do that. So here I sit.
And the other major reason is intravenous drug use. Is that right? Or
Yes,
is that
yes,
one of
I
the
think that's right,
contributing-
but that's not a major issue. I think just in terms of patterns of behavior, African American women walking into the office, they have multiple sex partners, and I almost think that we've lost a bit of our moral compass here. I'm always surprised at the number of partners that women have, single women, multiple partners, no condom use, no discussions about getting tested. I think a lot of women have low self-esteem, and they equate sex with love, and so they're very promiscuous, trying to combat the low self-esteem.
Then I would imagine there's this whole thing of it can't happen to me.
Exactly.
Also, Zina?
Yes, an issue of desensitization. Although they know that it's around them, it can't happen to me. I'm not going to change any aspect of my behavior because I will not be affected. Now, what I've also found in some of my research, I've interviewed women who've recently been released from prison and those who are in the community. And one of the things is that they do use drugs, but in terms of the reasons why they use drugs is because they're trying to escape a violent relationship. And so what happens in this case is that they've used these drugs to escape the violent relationship. Once they're released from prison, many of them are HIV positive, they're back into a society that is not ready to re-socialize them. Then they carry that stigma again outside of the prison walls. And that contributes to the problem as well.
Ruby, when you have to tell people that you're HIV positive? Or when you got into a relationship before you and your husband got married, for example, what was that like? I mean, how do you have that conversation?
To be honest with you, the conversation wasn't had. It was still, okay, there's a connection between him and I don't want to break this connection. And that's it. You don't talk about, I had my tubes tied after I had my son, so I wasn't worried about getting pregnant. And the thought is, well, I can treat anything I get. I can get a pill or get a shot and move forward. You just don't. Even though I knew it was there, I was very aware of it being there. I worked in a hospital. I understood, but it never crossed my mind that it would impact me or affect me.
The fact that African American women disproportionately get sexually transmitted diseases also, does that increase the likelihood of HIV, or does that add to?
One of the things is STDs travel together, so many times you don't just get one. You know, you can get HIV and syphilis, gonorrhea, chlamydia, so definitely having a STD infection involved increases the likelihood of HIV transmission.
So talk to me about testing, because I know that there's still a stigma. First of all, we've come a long way.
We have come a long way.
In terms of how long it takes to get a result and so forth. Today, give me the reasons why people need to get tested, and how often?
I would say, I mean, first and foremost, I think, you know, sex needs to become very much in the backseat. It needs to become a back burner in terms of a relationship. A lot of people, you know, meet people they don't really know, jump into bed with them. So I think before there's any conversation about sex, you need to talk about getting tested, you need to talk about morals and values, you need to talk about prevention, condom use, and you can get tested at the health department for free. And so we encourage people to do that all the time. There is something now called opt-out, and basically HIV testing is going to be offered unless you refuse it, and that had not been happening before, like in emergency room situations. And so I think that's going to increase the likelihood of people getting tested, but anyone having sex should be tested.
And once you're tested once, do you need to keep getting tested?
Well, I think, you know, it depends on your behavior. So, you know, if you're changing partners, you probably want to get tested every time you change partners. You always want to use condoms, and I would say at least, you know, probably at least twice a year for most people.
Zina, when you talk to women and so forth, do they talk to you about how they enter into that conversation? I mean, you're right, we should have the conversation, but it is difficult, especially when you're in a new relationship, to go, you know, we need to talk about this.
It's very difficult because in many cases that societal stigma is something that they've been affected by as well. They're carrying that stigma to the point where they're internalizing it. And it's very hard to begin discussion in a new relationship when you feel that way about yourself. So as Ruby mentioned, you know, issues of self-worth and self-esteem are so important, so that you're honest with the partner and let them know exactly what is going on so that you can move forward.
So Ruby, what would you tell somebody to say specifically? How would you open the door?
I think that the biggest thing for a woman is to have a conversation with herself, really, and kind of prepare yourself. Say, okay, well, tonight, if it happens, it has to happen the way I want it to happen, which means that you have to take control of the situation. And if it means you say, yeah, we can do this, but we need to use a condom, don't depend on him to have one. Have one yourself. Because that sets up another issue. Well, I ain't got no money. I don't feel like going anywhere. I don't have any way to get there. That kind of thing. Everything's closed. Well, I have a condom, and if you want to do this, this is how we need to do it. And I would imagine recognize also that if he absolutely refuses, then that needs to tell you something about that person. Right.
And that
he doesn't care enough about me to protect me. But it also opens the opportunity for him to say, well, why don't you want to have sex with me like that? And then you can have the discussion if you're comfortable. The big piece is being at the position where you're comfortable enough to have the conversation. And if you're not comfortable enough to have the conversation, then you're really not comfortable enough to have sex with that person.
What do you all feel about people who don't tell?
You know, I'm going to tell you, there are a lot of people, and this is terrible to say, there are a lot of patients who are positive who do not disclose their status. And I think women, unfortunately, put a lot of trust in men. And a lot of people, you know, can pass on HIV and they don't know it, but then there are a few people that know they have this virus, and unfortunately they are having unprotected sex, and that's just real. So I think as women, we need to stand up and have a voice, and we need to protect ourselves. And the other interesting thing is that women don't date. A lot of women, a lot of patients that I talk to, they automatically think when they go out on a date with someone that, okay, we go to dinner, we go have sex. And when I try to say, well, no, that doesn't have to happen. Yeah. So a lot of times I think it goes back to self-worth, self-esteem. A lot of women don't feel worthy that, you know, someone can take them out on a date or to a movie without having sex.
So that mindset has to change.
Absolutely.
What about talking to our daughters?
We need to be able to talk to them very early on. We were talking now about women, but we can't forget the young women. Teenagers. We've even talked to teenagers who've gone through this and whose mothers have also gone through this. And there has to be that discussion from the very beginning, but the discussion should center around empowerment, feelings of self-worth, positive self-esteem, so that you can make the right choices. Because society is not going to make those choices for us. We have to be able to make those choices. Society is there to put the labels on us. Society is there to stigmatize. But if you're empowered, if you have that sense of empowerment, then when the stigma comes, it won't affect you as much. And that's very important.
Alycia, AIDS was at one point automatically meant death. People are living with HIV, living with AIDS now through the cocktails and so forth for longer and longer periods of time. In terms of getting medication and so forth, I know I've read some of the federal funding, and for those who can't afford it, is starting to dry up and that kind of thing. What do we need to do? Or what's happening on that front, I guess is what I'm asking.
With legislation, I mean, I think, you know, people need to talk to their congressmen and their senators. Right now, there's a program called ADAP, Age Drug Assistance Program, and right now we are not able to enroll people in ADAP program. And ADAP is how our patients who don't have any insurance, that's how they get their HIV medicines for free. And right now, I think Dr. Oldfield told me there's approximately 800 people on the waiting list throughout the state of Virginia.
To be able to get onto that list.
And so right now, in order for someone to get their medication, we have to access the pharmaceutical companies through their pharmaceutical assistant program to get HIV medications for patients. And so that has become a big problem.
We have a few minutes left. I want to know, what are still the myths about HIV that are out there that you want to dispel? I mean, here's your opportunity to say, look, people, this is true, this is not true. You have any?
Women can pass the virus to men. It's much easier for women to get the virus from a man, because if you think about it, we're open. But and the other thing that Alycia said, they travel in pairs and packs. You don't just get one, you get 2 or 3 at a time. My personal thought about this, the more and more I go through this, is that I think that an HIV test should be part of your regular health screening, like when you get a pap smear or colonoscopy, or that should be part of your regular routine.
So that it takes away that stigma even of the testing.
So it just becomes normalized.
It just becomes normalized.
The other is that it can't happen to me, but it can. But it can. We have to get past the point where we've become so desensitized that we think it will always happen to someone else and we can't be affected.
Right. It's not a gay white man's disease.
Not anymore.
Not anymore. And it really is prevalent within the African American community.
Right.
And more in terms of women. So we need to pay attention to that. Any other myths?
I think
anything?
youth. And one of the things that we're seeing right now is the youth are really being affected. So you think about, there's about 2.6 million new infections, I think, in 2009. That was one of the statistics, where nearly half of those are in people between the ages of 15 and 24. And that is literally what we're seeing walk into the clinic right now. 18, 19, 20-year-olds. I can't tell you, how many of these patients that we're seeing on a weekly basis, but it is absolutely gut-wrenching to see these kids walk in, and some of them are 20 years old and they already have AIDS.
And this is because they already contracted it from having sex?
From having sex, yes.
Wow.
Yes.
Wow.
Yes.
My goodness.
And so it's very disturbing. And so I think one of the main things, our young people are having sex at a very early age. Yeah. A lot of these young girls are having sex with a lot older men, and I think it's setting them up for infections, HIV, pregnancy, and it's just really getting bad in terms of our young people.
So the bottom line now is talk to your kids.
Yes.
Talk to go get tested. Right. And if you need more information, can they call EVMS?
They can absolutely call EVMS. They can call the AIDS Resource Center, which is also a part of Eastern Virginia Medical School. They can go to their local health department. They can get tested for free there. They also have lots of information there.
So there is information out there. So just do it, right? Ladies, thank you so much for joining me. This has been some great information. And when we come back, tackling childhood obesity while teaching English, math, and social studies, we'll show you how one Suffolk school is making a difference. But first, here's what's happening in Hampton Roads. Over the last 30 years, the number of Virginia children diagnosed as obese has more than tripled. As a result, these children suffer more health problems and subsequently miss more school than their classmates who are not obese. Schools alone can't solve the problem, but many are finding creative ways to do their part. Our Alycia Dickens takes us to Elephant's Fork Elementary in Suffolk, where fried foods are being replaced with baked and exercise is now incorporated into core classes.
Ready? Go.
We're all pretty used to watching students answer questions while sitting at their desk.
Okay, once you've made your selection.
But at Elephant's Fork Elementary in Suffolk, teachers are encouraged to keep things moving. It's a pretty good way to burn calories, and the best part, the students love it.
Oh, it was fun and I liked it, and I focused more when I was active.
And you can have lots of fun doing exercises and doing activities like math, science, social studies, like that.
And go.
Our school board recognized that overweight children are less likely to achieve academic success. And knowing that correlation, they decided to implement a wellness policy. Not only physical activity, but nutrition, our nutrition guidelines. We've tried to reduce fats and sugars in the foods that we offer our students during the school day. For example, we've pulled all the deep fat fryers out of elementary schools. We don't even have them. We offer French fries on a limited basis at the middle and high schools. We try to use low-fat beef in, tacos or spaghetti. Our pizza offerings, we have low-fat cheese, low-fat pepperoni, and we've introduced whole wheat crust.
Suffolk's efforts were recently enhanced even more. Thanks to a grant through the OBC Healthcare Foundation, Suffolk Public Schools was able to hire physical education teacher Tara Worley as their new health wellness coach.
She kind of acts as a liaison between the school nurses, food service, physical education teachers, and core curriculum teachers. And part of her job is to help develop lessons that can be used in the core curriculum area to provide movement in the classroom, as well as in the physical education classes, help teachers offer activities that will be lifelong activities. Not something that they would have to do just for that period of time and then give it up.
Go!
These initiatives help to create a more healthy school environment at a time when a lack of exercise, coupled with poor eating habits, is literally killing our children. The United States is in danger of raising the first generation of children who live sicker and die younger than their parents because of childhood obesity. But thanks to action-based lesson plans like the one being implemented here in Suffolk Public Schools, that could change. Many of these action-based lesson plans were created by the Williamsburg-James City County's School Health Initiative Program, or SHIP. In 2009, WHRO's Center for Regional Citizenship helped to create a partnership that enables SHIP to provide training and share more than 600 lesson plans with Suffolk teachers.
I'll stop what we're doing. Okay, everyone stand up, and we'll do our spelling words just to get them, it gets them up, it gets them moving, helps them focus a little bit better, gets the wiggles out. It's helped a lot.
For Another View, I'm Lisa Godley.
And they sure look like they were having fun with it, too. We thank you for joining us this evening. We'd love to hear from you. Become a fan on Facebook or sign up for our eView newsletter, a once-a-week reminder of upcoming programs. You can sign up at anotherview.tv. We'll be back in 2 weeks when we'll examine the relationships between black men and women and pay tribute to dads for Father's Day. We'll see you next time for Another View.
Production funding is provided by A. Reddix and Associates, Health Information Resource Center, offering short-term training for long-term professional careers in medical coding. HIRCVA.net.